we faced pretty significant budget cuts just, as you said, a little less than a decade ago. And the Health and Human Services took the brunt of those cuts. What I think is just really important to emphasize is that when we cut $1 of state investment in health services, we lose $1 to $2 on a federal level.
Hello, one and all, and welcome back to a brand new episode of The Rural Impact. You know, we are the podcast that works hard to connect the dots between policy and rural everything. As we say all the time, rural quality of life. I'm Michelle Rathman, and to our return listeners, thank you so much for coming back. We so appreciate you. And if you're new to the podcast, welcome. We are also glad that you are here, and we hope that you become a subscriber and a super fan of the show. We really appreciate that. All right. Before we get started, a couple of housekeeping notes, as I always have to do. Please be sure to visit theruralimpact.com. And when you go there, hit that subscribe button, because when you do, you will receive updates, show recaps, previews of what's coming next. And we promise you, we do not share or sell your information. That you can be sure. Also, when you're on the website, be sure to visit our merch store. Every purchase does help us bring you this content. And if you like what you're hearing, we do appreciate the purchase. And for those of you who are buying our t-shirts, our bags, our water bottles, our notebooks, we are so appreciative. Also, make sure that you follow us on social. You can find the Rural Impact podcast on LinkedIn, on Blue Sky, on Facebook, and you can also follow me as well. And the best place to do that is on LinkedIn at Michelle Rathman. So with that said, let me tell you about today's show. You know, we have been working on an ongoing series that's focused on rural health transformation. And this is one of those episodes, but we are not specifically talking about the $50 billion fund. We're actually shifting our conversation over to focusing on the state of Montana, because Montana, like Nebraska, and you heard from our guest, Jed Hansen from Nebraska the last time around, Montana is one of those states that went ahead and kind of like hit the press the go button, the gas, if you will, on implementing Medicaid work and community reporting requirements. So for this conversation, it's a broad-based conversation with someone who is very much in the know in the state of Montana, and that is Heather OLoughlin, Executive Director of the Montana Budget and Policy Center. She has so much great information to share with us and really serves as kind of I think a model, kind of maybe foreshadowing of what other states are about ready to have set in motion in their states as well. So with that said, I always invite you to tune out that background noise, because we know that it's going to be there long after our conversation is over. And sit back and put yourself in that podcast listening frame of mind and hear my conversation with Heather OLoughlin. Are you ready? I am, and I know you are too. So let's go. Hey everyone, as promised, I am so pleased to be joined today for this episode by Heather OLoughlin. And Heather is the Executive Director of the Montana Budget and Policy Center. Welcome to the Rural Impact. I have to tell you, we are so appreciative for your time. We're so happy that you are here today for another dot connecting conversation focused on rural health transformation. But I have to say, full disclosure, it's probably not the warm, fuzzy conversation that people would prefer to listen to today, because there is a lot of things going on that are not so nice. So thank you again, Heather, for joining us.
Yeah, thank you for having me.
I was listening to a call on for Georgetown Center for Children and Families, and you were on, and you gave such a great overview of what's happening in Montana. And folks of this listening to this podcast know that we are tracking transformation state by state, but we're not just looking at that $50 billion fund. We are really making sure that we put side by side, like a split screen here, the other things that are happening. And so with that said, just over a year ago, on July 2nd, 2025, the Montana Budget and Policy Center posted a release with the headline, 77,000 Montanans left behind by Congress. So I've got it in front of me. I would really like for people to understand what that means, and we can kind of blow that up to the bigger picture that's happening. But Montana is a really interesting case.
Yeah, absolutely. So, we were referencing the one big beautiful bill and its pretty significant changes to Medicaid expansion eligibility and how that could impact Montanans. Montana expanded Medicaid in 2015 with strong bipartisan support, and it has been really a crucial aspect of our healthcare system in Montana. So we, raised red flags and continue to be concerned about new requirements and new barriers in accessing Medicaid coverage and what that means for the, over 70,000 Montanans who are currently enrolled in expansion, but also the implications of that on our entire healthcare system.
Mm. And it's no small number of the 77,000 people. That is a lot of individuals facing, quite frankly, some very rough times ahead as a result. So Montana, for example, is moving forward early with Medicaid work and community engagement reporting requirements. I've been having a lot of conversations about this. Even today, we're recording on August 7th, and we know that the jobs report was not great. 43,000, I think, people have lost their jobs, and that means employer-based insurance goes away as well, which is also increasingly, the premiums are getting higher and so forth. So what are the concerns about how these policies are projected to impact patients and, frankly, providers too? Because we also know that one of these provisions could mean that physicians are going to have to figure out how to document whether or not an individual is sick, too sick, not too sick, and so forth. So let's talk about that and the implications of that policy. Yeah.
So our state announced in late 2025 its intention to move forward quicker than the federal law requires in implementing the community engagement work requirements. They put in place those requirements starting July 1. So we're just roughly a little more than a month into that. And, I think that we anticipate to see pretty significant loss of coverage as a result. We have, the state of Montana relies very heavily on part-time workers in a lot of lower wage sectors, hospitality, retail, tourism. And, I think these individuals have relied on Medicaid coverage when they don't often have access to employer-sponsored coverage. So there's a lot of concern and a lot of worry about what this might mean for individuals who are working sometimes in multiple jobs, what type of paperwork they're going to need to submit, how frequently they're going to need to submit. And there's just a lot of confusion and concern happening right now.
I think on the other side of that, I wonder what you can share with us about how the state has been able to stand up new systems to do said tracking, because what we're hearing from our resources is that, like, hey, we don't really have the system set up, but we're just going to launch the plane and see if we can make it fly. What's going on in Montana in that regard?
So the state has announced that they are intending to hire 59 more state workers to essentially review and verify compliance or exemptions with the community engagement requirements. That's a pretty sizable increase in 59 workforce. Yeah. For a state like Montana. So I think it wow. really shows the level of kind of red tape and bureaucracy that we are potentially facing with this. We had I think like many states, we saw a very significant decline in Medicaid enrollment as a result of the redetermination process after the pandemic. We saw, one of the highest rates of reduction in enrollment of children on Medicaid. So I think that we have some lessons from that experience. The state had a significant backlog of renewals, huge wait times to get help or get support on the helpline. So I think in some ways it's encouraging to see that the state is staffing up, but it is a question of whether or not it's going to be enough. I think the other thing that we know is that the if we want to see this go as smoothly as possible, being able to access available data to verify that someone is working, to verify that someone has a serious medical condition, to eliminate that sort of like shift to the individual enrollee to submit paperwork, that's incredibly important. And I think that we have a lot of concern about the state's readiness to use available data, which is required by the federal law.
Right.
And I think that, the implications of that, I think, is increased loss of coverage potentially.
Mm-hmm.
People are just going to get stuck in these processes and not know quite what they need to do to keep their coverage.
Mm-hmm. All the while, that does not mean that people all of a sudden, their bodies press pause on the need for healthcare while they may already have a pre-existing condition.
Yeah.
And then we're talking about the loss of care, even when it comes to wellness and prevention and things of that nature. And of course, we know the ripple effect. We talk about it all the time on this podcast to health providers, to hospitals. And I know, Montana is not spared the challenges of your rural hospitals, in particular, safety net health providers and so forth. So it is a very slippery slope, if you ask me.
Oh, yeah, absolutely.
Heather, I know that Montana has had its share of budget challenges, budget cut challenges specifically that impact healthcare delivery, health outcomes, including closure of several offices of public assistance back in 2018. So not quite a decade ago. Also cuts to housing support for young at-risk mothers, in-home care for seniors, and those with disabilities living in their homes. Again, long before H.R. 1, which in June of 2025, the state legislative division estimated that Montana's budget would take a $160 million hit. What can you tell us about those numbers today?
Yeah. So, we faced pretty significant budget cuts just, as you said, a little less than a decade ago. And the Health and Human Services took the brunt of those cuts. What I think is just really important to emphasize is that when we cut $1 of state investment in health services, we lose $1 to $2 on a federal level. So, cuts during a special session in 2017 cut about $49 million in state funding for health and human services, resulted in a corresponding $60 million reduction in federal funds. So a huge loss of health services across the state. As you said, the closure of 18 rural offices of public assistance where folks were able to go and get in-person help to access Medicaid and public benefits. A real decimation of health services, particularly in rural communities, including behavioral health services across the state.
Right.
And I would say that, under this current governor, I think there's been a real recognition that we need to invest more in behavioral health services. So there's been a lot of effort over the last several legislative sessions to rebuild some of those programs that were lost in 2018. And it is incredibly hard to rebuild once you've cut. So there's a lot of work, a lot of attention around behavioral health services at the same time that we're seeing another potential round of budget cuts that will hit health and human services and loss of Medicaid coverage. So there's a considerable amount of tension here when we talk about what are the new investments that we need to be thinking about to expand access to health services, particularly in rural communities, when we're also seeing cuts and losses. The state had announced just a few months ago that it is not moving forward with a scheduled Medicaid provider rate increase that was built into the state budget. Again, strong bipartisan support and recognition of the importance of Medicaid provider rates. Mm-hmm. The state announced, given budget constraints, that it would not move forward with that scheduled provider rate. There are a lot of providers that are very worried about what that means for them. and for their workforce, right? I mean, a big part of this is keeping people in the workforce and in these rural communities. And that becomes harder and harder when the state is shifting. And I think cutting in areas that are really going to have long-term effects.
Yeah. It seems so counterintuitive to we know that we need to increase this, but we're going to decrease that. And then, it's a loss. There's no gains. And speaking of gains, so I want to just switch a little bit to RHTP. I know that this is, something that we are all talking about. I want to share with you and our listeners. My husband was at a physical therapy appointment this week and ran into an old neighbor who said, "Oh, I'm sure your wife is really happy that there's a $50 billion. He goes, "Let me tell you a little bit about that." So he's been listening. He's not in the industry, but so Montana was awarded just shy of about $234 million in the Rural Health Transformation Program funds for fiscal year 2026. And as such, this amount really, as I'm reading it, is the fourth highest award in the nation for FY26, despite Montana's smaller population. And some in the industry say that it really reflects the strength of the state's RHTP plan. Now, in Montana's plan, the funds will be allocated. I'm just going to tick them off here real quick. 5 core initiatives: workforce development, coincidentally, we're talking about that; sustainable access, innovative care models, community health prevention, technology innovation. All of it looks great on paper. Furthermore, if annual funding continues at this level, Montana could receive, if they do everything right and do all the paperwork and prove and so forth, that they could receive more than $1 billion over the 5-year program period. But Heather, as we do here, I want to connect the dots, specifically when it comes to workforce, sustainable access, and community health prevention. Because of the conditions you've just described, I wonder if we could talk just a little bit about maybe what the Montana Budget and Policy Center projects will happen, even with this funding, knowing that there is absolutely a decrease in access, challenges in workforce retention as a result of what you just shared with us, loss of coverage and so forth. So how is this going to impact the state's budget? On one hand, you could see $1 billion. What's the juxtapose that to the losses that you project?
Yeah. I mean, I think that there is a lot of excitement, interest, curiosity around what the Rural Health Transformation Program will bring in Montana. The state has spent considerable amount of time developing those different initiatives. They have formed an advisory council. There's a lot of engagement in RHTP here in Montana. I think that, they just yesterday had a meeting to discuss the next steps for RHTP. And I think what was really telling is the extent, like how much conversation and consideration there is about the role that Medicaid will play in this. More than half of Medicaid enrollees in Montana reside in rural communities. It is really the backbone of the health system in many communities and particularly in rural areas. And so there's tension here, right, on what does this look like if we can't sustain our Medicaid program and Medicaid coverage. At the same time, we're rolling out these pretty significant new initiatives. From a budget standpoint, I think the state has discussed and is thinking about that sustainability component of it. I think it's still pretty early to know what this is going to look like, 3-4 years out. But I think that we, again, I mentioned that this current governor had a pretty sizable initiative around behavioral health services and appropriated $300 million in his first legislative session to dedicate toward behavioral health initiatives. And the sticking point has really been the nervousness and the lack of commitment by the state to sustain those programs over time. So a lot of, efforts on a one-time only basis that you can certainly establish additional beds, But if you don't have a sustained workforce to serve those patients, it doesn't work. And so I think that this has been a real challenge in Montana, with, particularly conservative lawmakers who see and acknowledge there's an issue and are unwilling to support long-term investments and sustained investments to address it. Mm-hmm. So I think that, again, it's early in the RHTP process. I think we'll have a sense in the next year, like where are the successes, what feels like it's working, and then how do we turn around and talk to our legislature about what does it look like to sustain this support. That's going to require, a pretty significant conversation about sustained revenue sources, and building that into the budget in a sustainable way. So I think that there's a lot of question and uncertainty around what that's going to look like.
Yeah, and Heather, one of the things that plays in a loop in my mind always is the whole notion about transformation. And what does that actually mean when you're talking about the well-being of the individuals, the lives that are transformed as a result of these investments? And to your earlier point, data will tell the story. So I ask the question of everyone who comes on this show, at the end of the day, let's revisit in a couple of years, and how has it transformed the health and well-being of the populations that these dollars are not meant to enrich tech companies and things of that nature, although there's plenty of fear around that. And to your point, sustainability. And if you stand up a program, how do we make sure that those who should benefit from it are able to benefit from it because they have the coverage they need? Because my guess is no new initiative is going to just pay for itself, and it won't provide free care. So you get what I'm saying. We got to connect some more dots.
Yeah, absolutely. And I think that there's certainly some positive aspects. I think the workforce question is a real big one for us in Montana. And so what does it look like to sustain that? What is the state's role in supporting that? I'll also say we are currently working on a report that hopefully we will have released in the next month or so around maternal health in Montana, which continues to be a real challenge in rural areas. And we've seen already the closure of maternal health services in certain communities. We really see RHTP as an opportunity to target that investment to maternal health. And, that is not at this point a clearly articulated priority of our RHTP plan, but we're hoping that will be considered. So I think there is definitely opportunity. There's no question. But we're already seeing in Nebraska, who is a couple months ahead of us in implementing the community engagement requirements, that individuals who are pregnant, who should be exempt from the community engagement requirements, have lost coverage, right? Just as a result of the barriers and the paperwork and confusion. So if folks who are eligible for Medicaid can't get coverage, our support of the maternal health services across the state isn't going to work, right? If people can't get that coverage. So these two things go hand in hand. And I think that folks on the ground are really thinking about that, pushing the state to keep that in mind. We can't be successful with RHTP if folks can't get coverage. So,
and not just coverage, but obstetric services are not. I know this firsthand. We need to make sure that it's safe care as well. And we're looking at a crisis from my window, where we are seeing more and more women coming and delivering in emergency room setting and an EMS setting. Absolutely not ideal. And so coverage is one thing, access is another, but we had to take a look at, to your point, that workforce. If the conditions are so tumultuous, that it drives providers away, physicians away that specialize in this care, because it's a specialty, to be sure. And I know that your state is very challenged on that recruitment side of things as well. Oh my gosh, Heather, there's a few more things I want to make sure I talk to you about before we go. This one was a particular interest to me, although it does not have to do with rural health transformation, but it does have to do with investments in public services. Recently, there was a proposed ballot measure, C-134, that would decimate local public services, and you all were very involved in those conversations, as we should say, and the efforts to address the challenges that would pose. Can you talk a little bit about that? Because I know I have a lot of listeners out there that are facing the same circumstances.
Yeah. So just to take a step back and start from kind of a year or two ago, there were conversations around our overall property tax structure. We have seen, like many states, significant increases in property values and home values that are really pricing out many Montanans. A component of that is property taxes, and particularly property taxes for Montanans who may own their own home or rent, that are living on lower wages, and their property taxes are a significant portion of their income. So we worked with a bipartisan set of legislators to reform Montana's property tax structure. That bill passed in last year, and it did a couple things. One, it adjusted our property tax rates to create sort of a tiered rate structure. So for property values at the median, saw a property tax reduction, and extremely high value homes that are largely owned by folks who don't live in Montana on a full-time basis, saw a rate increase. Starting next year, the state will put in place a separate higher rate for non-owner occupied properties and short-term rental properties. So this was a pretty significant effort last legislative session. And this spring, there was a push by a couple legislators who proposed really rolling back those reforms and resetting property tax rates immediately, if passed, back to the lower rate over the last 3 years. It would have resulted in nearly $200 million of local government revenue lost right away. And for some communities, that loss of property tax revenue represented, upwards to 20 to 25% of their overall budget. So there was a lot of concern from local governments, particularly in rural communities, about what this meant. And those who were ultimately benefiting are not Montanans at the median home value, which have seen their property tax rates go down. It was those very high value, largely out of state owned properties that would benefit. So we raised,
So Heather, I'll just say, if I could, what that means is that for those whose primary residence isn't there, even though they don't see the value potentially in the services, we're talking about a reduction for law enforcement, for first responders, for roads, for infrastructure.
Yep.
So major losses should this have moved forward.
Yep, absolutely. And, one of the biggest areas that would have been impacted is rural fire districts. And we are sitting, in a very tenuous place this summer with a very hot summer. It would have just right out of the gate decimated rural fire districts. So ultimately, the proponents decided not to move forward with the initiative. I think a huge relief to many of us and to local governments. And I think that this conversation certainly is going to continue, but there is a lot of tension around, very high home values who may not necessarily live and use those community services, you know, pushing for changes that will absolutely impact the local community.
Yeah. I bring this up because my last question to you and to most guests who come on the show, advocacy works. We know that sometimes it can feel like we're talking into a void and no one's listening, but I know that's not true. And what you just shared is proof that the more we advocate with really good intentions and being fact driven, not fear mongering or anything like that. So I want to just ask you this. We're going to call it how we make an impact. Okay. So for our listeners in Montana and across the U.S., share maybe one advocacy tip on how best to bend the ear of those who are making policy decisions that impact rural quality of life.
Yeah, absolutely. I mean, I think that what we have seen and experienced is that the more local you can make it, the better. Mm-hmm. Policymakers do listen to their constituents, and their constituents have a story to tell. I think we've also experienced that when it comes to rural health, rural education issues, these are not partisan issues. Rural communities know and understand the role that their critical access hospital plays, their local school plays. And so I think we've really been able to paint a picture and tell a story about how can we invest in these systems to keep our rural communities alive, right? And I think that policymakers are responsive in many instances to their communities. And I think that in Montana, like that subset of legislators that are coming from rural communities are really helping to drive policy change.
Mm-hmm. And I will say, invite them to your community, invite them. There are some states where I talk to advocates. They say, our legislators aren't even coming to our community or their own districts to see what's going on here. And so I will just say, invite them for a visit, have a chat, if you will, show them the assets that you have and the need for investments and why. The why is so important as well. So, oh my gosh, Heather, it was really great to have you here today representing Montana. And it was really good information. And we're going to make sure that we put the link to your website on our website at theruralimpact.com. And if people want to follow you on social, where might they be able to do that?
So we are at Montana Budget pretty much across all social media. And yeah, please follow our work and really appreciate the time to share our experience.
My gosh, thank you so much, Heather. All right. Although we do have to say farewell to Heather for now, I'm going to ask you to sit tight because we've got some news from our partners at the National Association of Rural Health Clinics. And then after that, just a few closing thoughts. Stay with us. We'll be right back. Join the National Association of Rural Health Clinics in Louisville, Kentucky, September 28th through October 1st for the NARC Fall Institute, the only national conference designed exclusively for rural health clinics. Now, this isn't just another healthcare conference. It's an opportunity to learn from experts who understand the RHC environment, gain practical strategies you can take back to your organization, and connect with professionals facing the same challenges you are every single day. Past attendees say they left with a better understanding of their role, new ideas to strengthen their clinics, and valuable connections with colleagues from across the country. Whether you're a clinic manager, CEO, provider, coder, biller, or just getting started in the RHC world, you'll find education and resources tailored specifically to you. And when the sessions wrap up, Louisville is yours to explore, from Churchill Downs and the Bourbon Trail to the Muhammad Ali Center and more. Invest in your clinic, invest in your professional growth. Join NARC at their Fall Institute by visiting NARHC, that's NARC.org, to register today. Once again, I want to make sure that I send a very big thank you out to Heather OLoughlin, Executive Director of the Montana Budget and Policy Center. Thank you so much for your insight, your information. We are going to continue tracking transformation in that state as well as all the others. So stay tuned for more of those conversations. And of course, I always want to make sure that I thank our wonderful partners at the National Association of Rural Health Clinics. Visit our website at theruralimpact.com. Look at those show notes because the resources that we talked about on today's podcast will be there, and you'll be able to find all that with just one click of the button on our website. And we'll take you out to these other resources. Again, to all of you, thank you for joining us. And I'm going to say it as I always do, and I mean it, especially to those of you whose states are engulfed in flames at the moment, Washington State, Oregon as well. Please take the best possible care of yourself and to the best of your ability, all those around you. We will see you again very soon on a new episode of The Rural Impact.